Regarding twins, so in the first trimester, I think we have to ascertain the chorionicity, whether it is a monochorionic twin or a dichorionic twin. And if it is a monochorionic twin, then the risk assessment is the same for both the twins. Whereas if it is a dichorionic twin, you have to give a different CRL and a different NT measurement, and so you will get a differential risk. But then no serum screening for twins in the second trimester. It has to be over in the first trimester. And there is no second trimester screening for twins. And you just go by your NT measurements and other parameters, ultrasound parameters in the twins for assessing risk for aneuploidy. So that is regarding twins. And regarding the next question was NIPT. So NIPT, because of the cost, we are not able to offer it to all the women right away. And we specifically use it for women who are at high risk. So a 40-year-old woman who has conceived by IVF and she doesn't want to take a chance of an invasive test, and she wants to have almost near normal screening, so like near to a diagnostic, a result which is near to a diagnostic test. So then we offer NIPT. And the model which we are contemplating to use in our place is the contingent model which I explained. So risk stratify women into 3 categories. So women who have a risk more than 1 in 100, definitely they go for direct fetal testing. And women who have a risk of 1 in more than 1,000, they don't have any more screening or testing. They just follow routine ultrasound. And the intermediate risk category, that is between 1 in 100 and 1 in 1,000. So they may be offered NIPT if they want to have a better screening. So that is the model which...
What ultrasound markers you are taking, and first 9 to 14 weeks scan, apart from NT, you are taking into consideration all ductal flow, internal
ductus venosus reversal and tricuspid regurgitation, only those 2, apart from nuchal transparency and nasal bone.
Period by which the nasal bone appears, what is the limit of that? How many weeks you are taking as normal?
No, even in the second trimester we find absent nasal bone. Okay. So that has a likelihood ratio. If you don't find nasal bone in the second trimester, your genetic sonogram has a likelihood ratio.
Yes.
So even the absence of nasal bone till the second trimester is significant.
Okay.
Yeah, thank you.
How should I proceed?
The siblings of the lady.
Yes. The siblings of the lady.
The mother who is...
The mother, her sister and her brother are both having seizure disorders and severe mental retardation.
I think it is a very, very, very complex question, and we have to make a pedigree, we have to make take a lot of history, and what I feel, at this forum, if we go into that pedigree and getting what is the disorder she might be carrying, and because of that she aborted once. So I don't feel one abortion of early pregnancy, we should not jump into a conclusion that there might be some genetic disorder, because primary first trimester abortion within 8 weeks or within 10 weeks, it is a defect in the seed. That is defect in either in the sperm or in the egg, but most of the time it might be a defective egg, because out of 12 eggs produced in a year by a lady, 1 egg per month in a normal ovulation, there are 6 to 7 eggs might be having aneuploidy. If that makes a fertilized egg, that creates, nature is very smart. It doesn't want to have an abnormal baby to deliver most of the time. Down syndrome we identify, but most of the Down syndrome, they are vanished before we identify there was a pregnancy. So most of the things, we should not jump into a conclusion that there might be a genetic disorder. If there are repeated things happening, then we can go. But with this note, I want to end this. I want to end this question answer session, because we have to stick to the time.